I thought it was just part of getting older. The nighttime trips to the bathroom, the nagging ache in my hips. I never imagined these were the first whispers of something deadly inside me. It starts quietly, almost like a secret your body is keeping. A subtle change, easy to overlook. A late-night bathroom visit here, a dull ache there. But beneath these whispers hides a shadow that grows without sound: prostate cancer. This isn't a loud disease. It doesn't roar or blast warnings. Instead, it creeps in, camouflaged as age itself. And when the signs finally scream for attention, it's often too late. If you or a loved one is aging, listen carefully. This video could be the quiet alarm that saves a life. I'm Dr. Blake Morgan. For over 30 years, I've worked closely with men facing prostate health challenges, both the mild annoyances and the life-threatening emergencies. Prostate cancer is the second most common cancer among men worldwide, yet its early signs are so subtle, they slip under the radar. What makes this disease so dangerous is how easily its symptoms blend into what many older men expect from aging. Frequent urination, aches, fatigue. Men often dismiss these as part of just getting old. But here's the truth I've learned. Aging isn't an excuse to ignore your body's messages. Today, I'm going to reveal the 7 silent signs of prostate cancer that men often miss, sometimes until it's too late. By knowing these signs intimately, you gain the power to catch this disease early, when treatment is most effective. Let's begin. Sign 1. Nighttime urination. That's CIEPS, up quietly waking up once a night to pee. That's almost normal for men over 60. But when those trips multiply 2, 3, 4 times every night, that's when the story changes. I remember Mr. Thompson, a 68-year-old man who came to me complaining about frequent nighttime urination. He shrugged it off as getting old and didn't think much of it. Yet his nights were a battleground of restless sleep and constant bathroom trips. The prostate gland surrounds the urethra, and as it enlarges, sometimes due to cancer, it squeezes that delicate channel tighter and tighter. It's like stepping on a garden hose and watching the water pressure fight back. This pressure causes your bladder to contract more often, making you feel like you have to go urgently, even when it's just a little urine. Most men chalk it up to aging or too much coffee at night, missing the silent struggle inside their bodies. What they don't realize is that this frequent urination can be one of the earliest signs that the prostate is being affected by cancer. And ignoring it only lets the disease grow stronger in the shadows. Sign 2. Pelvic discomfort. That HIDES as ACHES, and pains. Lower back or hip pain that lingers, shifting and fading like a ghost. Most older men blame these aches on arthritis, hard work, or just life catching up. But what if the pain isn't just normal wear and tear? I've seen men come in complaining about dull, nagging pain in their pelvic area, hips, lower back, even thighs, that refuses to go away. When prostate cancer spreads, it often targets the bones, especially those in the pelvis and lower spine. But unlike a sharp injury or a burning nerve pain, this cancer-related pain is subtle, deep, and persistent. One of my patients, George, ignored his hip pain for months, thinking it was from gardening. When the pain worsened and he found it harder to walk, we discovered the cancer had already spread to his pelvic bones. The worst part. Because this pain feels vague, it's often missed until the cancer has moved beyond the prostate itself, making treatment much harder. It's a silent alarm ringing just below the surface, waiting for you to listen. Sign 3. Changes in ejaculation. That no one talks about. This sign is the one many men don't even realize they're experiencing, or are too embarrassed to mention. But the truth is, changes in your ejaculation can reveal a hidden battle inside your body. Take Walter, a 72-year-old retiree who came to my office reluctantly. He'd noticed that over the past several months, his ejaculation had changed, less volume, a weaker force, even mild discomfort. He told me, "I thought it was just part of getting old. I didn't want to admit it was anything serious." What Walter didn't know was that prostate cancer can slowly block or damage the tiny ducts and nerves responsible for producing and releasing seminal fluid. Imagine a river being dammed. The flow diminishes, the pressure changes, and the ecosystem downstream suffers. Because ejaculation is such a private topic, many men avoid talking about it, assuming it's just part of aging or not important. But it can be one of the earliest warning signs that cancer is interfering with your prostate's function. Ignoring these changes can mean letting the cancer silently grow without early detection. The question is, how long can you afford to stay silent? Sign 4, fatigue with no explanation. Fatigue is another symptom that blends too easily into the background of aging. You're sleeping your 8 hours, but still dragging. You used to hike, mow the lawn, play with your grandkids. Now, just walking around the block feels like running a marathon. Jim, a former marathon runner in his late 60s, was puzzled. "I'm eating well, resting, but my energy is gone," he said, his voice heavy with frustration. At first, he blamed stress or depression. What many don't realize is that prostate cancer can cause chronic inflammation and anemia, slowly sapping your energy reserves. Cancer cells steal nutrients, while the immune system fights a hidden war, leaving you exhausted even without visible illness. This isn't just getting old. It's your body's early SOS signal that something serious is lurking beneath the surface. Yet, fatigue is so common that it's often ignored or misdiagnosed, delaying crucial investigations. How many men push themselves past their limits before they finally ask for help? Sign 5. Unexplained weight loss. Weight loss can seem like a good thing, especially if you've struggled with your weight for years. But when pounds drop off with no change to your diet or exercise, it's a red flag flashing in bright neon. George, a man in his early 70s, thought his slimmer physique was a bonus. He was proud of his new look, but when his clothes started hanging loose and his strength faded, he became worried. Unexplained weight loss is a classic cancer symptom. The body is fighting a battle you can't see. Cancer cells consume calories voraciously, and your body enters a catabolic state, breaking down fat and muscle for fuel. This silent metabolic storm can leave you frail and vulnerable, weakening your defenses against the disease. Ignoring unexplained weight loss can allow cancer to progress unchecked, but recognizing it early can save your life. Will you notice the signs before it's too late? Sign 6. Blood in urine or semen, a quiet warning. Most men freeze the moment they notice blood. It's a stark, undeniable sign that something is wrong, yet many still dismiss it, hoping it's a minor injury or a harmless infection. I had a patient, Robert, who found a few drops of blood in his urine but waited months before seeking help. "It wasn't painful, so I thought it would go away," he admitted, regret thick in his voice. Blood in urine or semen can indicate that prostate cancer has begun invading surrounding tissues or blood vessels. The tiny blood vessels inside the prostate are delicate, and cancer makes them fragile, causing bleeding. The scary part, because it's so rare for blood to appear without a cause, it's often a sign the cancer has already advanced. Yet the initial bleeding can be so subtle, it's easy to overlook. Are you ready to face what your body is trying to tell you? Sign 7. Swollen legs or feet. The unexpected clue. Swelling in your legs or feet may seem unrelated to your prostate, but it can be a hidden red flag. When prostate cancer grows large enough, it can block lymph nodes or veins, causing fluid to pool in your lower limbs. This swelling isn't just uncomfortable, it's a sign the disease is interfering with your body's vital systems. I recall Frank, a 75-year-old who came in complaining about heavy, swollen legs. He thought it was from sitting too long or his shoes being tight. But underneath, the cancer was pressing on his lymphatic vessels. Ignoring this swelling is dangerous. It means cancer could be spreading beyond the prostate, affecting your circulation and immune system. Could this swelling be your body's silent scream for help? Here's the cruel irony. Many men think they'll catch prostate cancer early because they're watching for classic symptoms like pain or urinary trouble. But often, the very first signs are so silent and easy to dismiss that men don't realize something dangerous is unfolding until the cancer is advanced. The truth I've learned from decades of practice: prostate cancer is a master of disguise. It hides in plain sight, mimicking normal aging and hiding behind vague symptoms. Early detection isn't just about waiting for symptoms. It's about understanding these silent signs and acting on them before the cancer takes hold. Here's the hopeful truth. Catching prostate cancer early saves lives. When you recognize these silent signs and consult your doctor promptly, you open the door to early diagnosis and effective treatment. Screenings, PSA tests, MRI scans, and biopsies are powerful tools, but none of them replace listening to your body, the first warning system. If you notice any of these signs, frequent nighttime urination, pelvic pain, changes in ejaculation, fatigue, unexplained weight loss, blood in urine or semen, or swelling, don't wait. Talk to your doctor, demand the tests, fight for your health, because prostate cancer doesn't have to be a silent killer. Listen to your body before it's too late. Remember, the man who thought his nighttime bathroom trips were just age catching up, or the one who ignored his pelvic ache, blaming arthritis. Their stories could have ended differently with early awareness. Your body speaks in whispers long before it shouts. If you learn to listen to those silent signs, you might just save your own life or that of someone you love. Prostate cancer doesn't have to be a death sentence, but only if you don't miss the quiet warnings. What will your story be?